Hey, it's Medicosis Perfectionalis, where medicine makes perfect sense, and today we'll talk about malaria, which is a misnomer, a notorious disease, and remember the RBC inclusion, which we have talked about in my previous hematology playlist. First, before we start, first things first, we divide parasites into two main groups. We have the protozoa, very famous, and we have the helminths. Okay, not equally famous, but really bad. Okay, protozoa. This is today's topic. Protozoa are divided into three groups. The Sarcomastigophora, Ciliophora, and Apicomplexa. Today's topic is Apicomplexa. It has many subtypes. Hemosporidia, whatever, and this include Babesia, this include Toxoplasmode or Cryptosporidium. We don't care. We care about Hemosporidia today. The malaria, Plasmodium falciparum, Plasmodium vivax, Plasmodium malaria, Plasmodium ovale. There is another Plasmodium for monkeys. We don't care about that right now. Remember, malaria is the Plasmodium, is the Hemosporidia, is the Apicomplexa, is a freaking protozoa. Malaria is a wrong name. Mal means bad, like malfunction. Area means air. They thought that malaria is transmitted to you through airborne infection. Not true. Nonsense. The freaking female Anopheles mosquito has to bite your skin, so that's a wrong name. Can you imagine a salesman coming to your house? Oh, change your air condition filter so that you prevent yourself and your family from getting malaria. Oh, shut up. Malaria, the cause of organism, Plasmodium falciparum, Plasmodium vivax, Plasmodium malaria, Plasmodium ovale. The vector, the female freaking Anopheles mosquito. Geography, tropical and subtropical. If you remember, the earth is round and we have here lines of longitude like this, and we have lines of latitude like this. We care about the latitude. The one in the middle is called the freaking equator. Above the equator, below the equator, the tropical regions or the tropics. And then above it or below it, the subtropical or the subtropics. And this is the geography for malaria, tropical and subtropical. Africa is the most common. Why not South America? Because South America is also tropical and subtropical. I'll tell you why. For instance, if you remember the Inca civilization, they lived on mountains. And as you know, as you go up, the temperature gets cooler. So when the temperature is cold, this is not a suitable climate for the female freaking Anopheles. That's why the Inca civilizations did not suffer from malaria, at least to the same extent as their African counterparts. It was simply because of the elevation. So for the female freaking Anopheles, location and elevation. Cool. Now let's talk about the life cycle of the freaking malaria. It all starts by the freaking female Anopheles mosquito biting your skin and injecting sporozoites into your skin. Sporozoites go from your skin to the liver, and then they have infected your liver. They will release a sac called schizont or schisont, and then it's gonna rupture, releasing ugly merozoites into the bloodstream. They will infect your RBCs. Remember the red blood cell inclusions in the first slide? Yep. And then two things will happen. It will mature, and this is called now the ring form or the trophozoites. So here was the sporozoites, and here was the merozoite, and here is the trophozoites. Trophozoites, again, schizont, rupture, repeat the cycle, and that's why the patient feels cold, and then on the third day, fever. Cold. On the third day, fever again. And this is the erythrocyte cycle. Something else is going to happen to the ring trophozoite. It can mature and forming gametozoites, the gametes, male and female gametes. So now you have male and female. And then the gametocytes enter into the freaking female Anopheles. Male and female reproduction. This is sexual reproduction, giving you the zygote. And then the zygote will become a sporozoite, and then the freaking female Anopheles will bite your skin again and completes the cycle. Here is the female freaking Anopheles inoculating the sporozoites into your skin. Now we'll start with the pre-erythrocytic stage, which means before infecting the red blood cells. Pre-erythrocytic or exoerythrocytic schizogony. What is the schizo? It's the sac, the schisont. What is the gony? It's like a family tree, an offspring, a generation. And this is asexual reproduction. Let's start. Female Anopheles injecting and inoculating my skin with sporozoites. They go to the liver, hepatocytes, and then schizont. That's the sac that's going to rupture and release merozoites. Merozoites will infect the red blood cell. Please remember these three. Schizont is a sac. The sac will rupture and release the merozoites. Merozoites infect the red blood cells. Cool. Now, the erythrocytic stage is very important because this is the stage that will be relevant clinically, I mean signs and symptoms. Merozoites, remember they infected the red blood cell? Yep, they infected the red blood cell. Ring stage is called immature trophozoites. Then we have two paths. Either the trophozoite is going to mature and grow the flip up, or it's gonna go into sexual reproduction, the gametocytes. And then we have female and male. The male is the micro and the female is the macrogametocyte. They are ingested by the freaking female Anopheles when it comes to bite your skin the next time. And then they will have a zygote, and then the zygote will become sporozoite, and then we repeat the cycle again. The freaking female Anopheles will bite you again. This was the gametocytes path. What was the other path? The mature trophozoite. Schizoid is a sac. The sac will rupture and release the merozoites. The merozoites will infect red blood cell, and that's another erythrocytic cycle. I'm cold. On the third day, I have fever. Fourth day, cold. Fifth day, cold. On the third day, I have a fever. Cold. You know this? That's the cycle. Very quickly, the freaking female Anopheles will bite you, releasing sporozoites into your skin. They go to the liver, and this is the schizoid. The schizoid is a sac. The sac will rupture, releasing merozoites. They infect your red blood cells. Now it's called the ring stage, the trophozoite. Either I will mature, providing a schizoid that will rupture, releasing merozoites to infect the red blood cell and continue the cycle, or I will become a gametocyte. Male and female enter into the female Anopheles. Male and female equals zygote, sporozoite, and continue the next cycle. Is this hard? Let's talk about the sporogonic cycle. This happens inside the freaking mosquito. Remember the mosquito? The mosquito had the micro, which is the male, and the macro gametocyte, which is the female. Male and female inside the stomach of the freaking Anopheles. Male and female reproduction, this is called zygote, and this is sexual reproduction. The zygote elongates and becomes mobile. Ookinets. The ookinet will invade the mid-gut wall of the stomach of the freaking female Anopheles, and then it becomes oocyte. This is the egg. The egg will grow, the egg will rupture, the egg will release. Release what? The spores that were inside the egg, called sporozoites. And the sporozoites will reach the salivary gland of the freaking female Anopheles, and she's ready to bite you one more time. Cool. Now, what is the pre-patent period and what is the incubation period? Let's start with the incubation period because it's easy. It's the period between the point of infection, and this is the freaking female Anopheles biting my skin, and the appearance of symptoms of malaria. From here to here is called the incubation period. After the incubation period, I will start suffering from symptoms. What is the pre-patent period? The pre-patent period is important only for pathologists or for the lab, not for the patient. What is it? It's the interval between the infection, which is here, and the appearance of the parasites on the peripheral blood smear. Not the symptoms, but the parasites in the peripheral smear. In other words, it's the interval between the point of infection and the detectability of the freaking parasite in your blood. So, between the point of infection and symptoms is the incubation period. Between the point of infection and the detectability of the parasite in the peripheral smear is called the pre-patent period. The incubation period is normally 8 to 25 days in cases of malaria. The clinical picture of malaria: easy cycles of fever and chills, fever on the third day. Why fever? Because the RBCs have ruptured, releasing the merozoites, the malarial metabolites, and endotoxins, causing the fever. Next, cold shivering on the fever-free days or the fever breaks, and then followed by fever. Why the fever? Because the RBCs have ruptured. Fever every 3 days. We call this the tertian fever because tertiary means 3, and this happens with Vivax, Ovali, and Falciparum. Or 4-day fever, the quartan fever, because quartan means 4, and this is with Plasmodium malaria. Sometimes we can have continuous daily fever. This is rare. It can happen with Vivax or Falciparum. Falciparum is very evil. It can lead to severe. What do you mean by severe? I mean cerebral, neurological symptoms, postural problems, nystagmus, gaze palsy, opisthotonus, seizure, and coma. Opisthotonus. Okay. Headache, fever, fatigue, pain, cough, splenomegaly, nausea, and vomiting. How do we diagnose it? Microscopy, rapid diagnostic test, and molecular microscopy. Light microscopy, fluorescent microscopy. What are you trying to see here? Romanovsky scanner, the game sustained, the peripheral smear, thick and thin. I'm trying to look at the red blood cells. I'm trying to look at the red blood cells. I'm trying to look at the parasites in the red blood cell. The rapid diagnostic test, or RDTs, this is finger prick, and I'm trying to detect what? Antigen. Yeah, this is rapid. Yep, just get me the antigen produced by the malaria. It's called lateral flow immunochromatographic antigen detection test. It relies on capturing of dye-labeled antibodies because it's an antigen-antibody reaction. And when the antigen meets the antibody, they form a T-test line. And then you look at the line and you see if it's positive or negative. Molecular PCR and nucleic acid testing, or NAAT, for the malaria parasites and to detect resistance to therapy. Diagnosis of malaria, we're talking about microscopy, the peripheral smear. We have thick film and thin film. Thick film, why? To detect the parasite itself. So I can tell you that you have been infected. Infected with what? I cannot tell you. You should go to the thin film for that kind of information. Okay, pros. Examine large amount of blood. That's why we call it thick. Easier to detect light infection because it's thick. When you use a large amount of blood, it's easy to detect small infections. Cons, the disadvantages. It cannot speciate or identify the organism. It cannot say if this is malaria or babesia, and it cannot say if this is Plasmodium falciparum or Vivax or Ovale or Malaria. It's thick, that's why it's difficult to read. There is more debris when it's thick. How do you prepare it? Several drops of blood, put them on one slide, spread it onto 1.5 centimeter area. That's a big area, that's a thick film, and dry them for at least 6 freaking hours. Thin film to identify the parasite. Pros. Demonstrates the species, malaria, what type, Plasmodium, Vivax, Ovale, etc. Detects the mixed infection. Oh, I have malaria and babesia. Unfortunately, assess the parasitemia, which is parasites in the blood, RBC morphology, and see the characteristics of the parasites and the RBC inclusion, which is our parasites inside the red blood cell. Cons, smaller number of organisms. Yeah, it's called thin film, so we use less blood. Therefore, it's hard to detect light infection. How do you prepare it? Prepare it as you prepare any slide for differential. Fix it in methanol for 1 minute, air dried before staining. Speaking of staining, you can use the traditional Gimsa or you can use the rapid Romanovsky stain method. Thin film before you fix it. Put it in a fixing solution containing eosine Y without rinsing. This is rapid, baby, no, without rinsing. Transfer to solution C containing methylene blue, and that's why it's rapid, because it's without rinsing. The difference between Vivax, Ovale, Malaria, and Falciparum. Presence of Schaffner dots. Yes, they are fine. Yes, they are large. No dots, no dots. They have Murer's cleft, but they do not have Schaffner dots. The size of this infected cell. In Vivax, they are large. In Ovale, they are enlarged, crenated RBCs. Malaria, normal. Petit with Malaria. And normal with Falciparum. So no Schaffner dots and normal infected cell. Merozoites. 6 to 24, 4 to 16 merozoites, 6 to 12, 8 to 24. Gametocytes, round or oval, round, crescent. The fever periodicity, 48 hours, 48 hours, 48 hours, aka tertiary or tertian, 72 quartan fever. Thank you so much for watching. I'll see you in the next video.